This is the nursing session, session G for the Major Discovery Fair. And today you're going to hear from one of the pre-nursing advisors and the School of Nursing recruiter about their programs and kind of the requirements for students that are interested in doing nursing. As they are presenting, please feel free to use the chat to ask questions. And then we will go ahead and hand it over to Miss Leah Carpenter and Miss Annalie Whitman.
Thank you both. We're really excited to be here this afternoon. And we're really just hoping to make use of your time this afternoon and be really constructive to get you to the next steps of where you're trying to get to and all land here in the School of Nursing upon your first try. So as we are thinking about those concepts, what we want to do is also make you aware of all of the opportunities that there are when you are applying to nursing school. So what I thought we might do is we're going to keep this pretty casual today and make it more of a conversation. So you have both myself and as she mentioned, my name is Annalie Whitman. I'm over recruitment for undergrad and graduate programs here in the School of Nursing. So I really touch base with all the programs within the school. And so I'm really that first point of contact, no matter where you are coming in out of high school and you're trying to figure out where you want to go. So I may have met many of you along the way, in whether you're sophomores thinking about what you want to do out of high school, or you getting ready to graduate and you've already become a nurse and you're thinking about coming back as a graduate student. Maybe you want to be a CRNA, nurse anesthesia resident, or you want to be a nurse practitioner and want to continue your education in that manner. So there are a lot of different ways that I interact with students. You also have Leah with us, and a lot of you probably know her as well as you're someone you work with in advising. She's a very important person here today. And so I know she's VIP. And so, but she is someone who is, when you're working with your advisors in VMASC and in nursing, you always want to think of them. I always say your parent away from home, right? They're the people who are looking out for you. They're always making sure that you've got what you need or that you know what resources are available. And when we talk about VMASC, that is the hub of resource. So you want to take advantage, even if you don't know what to ask, you can always go to the people you've got here today and say, hey, can you tell me what questions I can ask to make sure I'm asking the right thing? So just keep that in mind today as we just lay out some information for you to hopefully get you to that next step. Okay. So I'm going to share a couple of slides with you. And what I want you to take away from this information, because there are quite a few things here, is that there are so many ways that you can get your BSN, okay? And there's not just one way. And there's multiple ways you can actually get your BSN degree from UAB. So let's take a look at that and talk through this just a minute based upon what I've got up here. So let me get up my highlighter for a second. Okay, so at the top of this, we're kind of looking at the different options that we can specifically get to a bachelor's degree, or what we're going to call an entry-level nursing degree. So first we've got at the top the BSN. So that's going to take 5 semesters, okay? And equivalent to that, there is something under here called the Joint Enrollment Nursing Pathway. And that is something new that we have with the community colleges here locally. There's one with Jefferson State in the Birmingham campus and Wallace State in Hansville. So you may hear about that. And if you do hear those terms, I don't want it to be confusing. They may ask you if you're interested in applying for that. And if you do hear about it, think about it, right? You want to be able to say, I can put my eggs in all the baskets to be competitive when I apply the very first time. Because if you were to be able to get multiple offers, right, you want to be able to say, I can accept the offer that's the best fit for me. And sometimes students are reluctant to apply to more than one place that first time, or they want to apply to the place that they have in mind because it's maybe the campus that they are in love with, right? Because that's where they always dream to go into school. But maybe UAB is associated with this other campus. And in this case, UAB is a partner with Jefferson State, Wallace State, and very soon 2 other campuses. And so in doing so, what that looks like is we will have a faculty member working with you while you're completing your associate's degree and bachelor's at the exact same time. Okay. So again, that's just an option. And when you graduate, you'll have 2 degrees. You'll have your associate's and bachelor's in nursing. So both of those completed in 5 semesters. Okay. And then below that is something called the Accelerated Master's in Nursing Pathway. And this is something that is really going to be only an option for students who have a non-nursing bachelor's. So I'm going to leave that out of the conversation for today because most of you aren't going to be eligible for that because you don't have a non-nursing bachelor's degree. Okay. And if we skip down to the bottom, there is a third option. This third option is a possibility if you decide that after you get started, when you're looking at the traditional BSN here at UAB, right? So you've got all your prerequisites completed and you've got all of that out of the way, that you want to get ready to apply for UAB's BSN program. You're good for that. You maybe also want to apply for the joint enrollment pathway because you want to be considered for that as well. But this third option would be that while you're applying for the joint enrollment pathway, that you want to consider yourself to be in the running for the traditional associate's degree in the community college system. Okay. Now, that would not be part of the partnership with UAB. That is separate from that partnership. But what it does is it would be an additional application that you're allowed to submit so that while you're applying for all of these options, that you put your application in with any community college and that you're going to have an opportunity to have one more application in, right? So worst case, you apply to 3 different schools or 3 different pathways. And if I get 1 offer, 3 offers, or 0 offers, I've given it my best shot to get into school the very first time. Does that make sense? We're all on the same page? Any questions so far? Okay. So I know a lot of you we've been focused on the BSN program at UAB, which is what I want us focused on, right? So I want to point out one major difference, and because a lot of you, it may be the very first time you're even hearing about this joint enrollment pathway. And I'm not trying to discourage anybody from applying to any of these pathways, especially our traditional BSN. I'm just trying to share with you information. So one thing that is very different about the joint enrollment pathway is that there is an ACT requirement. Okay, so I may have just blown you out of the water and discouraged everybody from applying by telling you there's an ACT requirement for that program. But when you think about applying to any joint enrollment or associate degree program, there is an ACT requirement. And that's a little bit different because the way they look at their point system, where we don't necessarily consider ourselves having a point system, it's just a way they look at the way they look at things. Our GPA requirement tends to be higher. And so, that ACT requirement for the joint program is a 20. Their traditional ADM program is an 18. Okay, so keep that in mind. And there are opportunities for you to take the ACT exam as a college student if you would like to take it. So you don't have to rush out and take it, but if you want to keep that as an option on the table, you can take it. So having said all of that, knowing now all of the options that you have and having worked with your advisors working toward the BSN, Let's talk a little bit about some of the questions that you have. So what are some of the pressing questions that you have that you've been working towards so far? What are some of the anxieties that you've had?
Okay, like people be, I heard a lot about like the NCLEX, and I'm like scared about the NCLEX because a lot of
Okay.
people don't pass it their first try.
Yeah.
They
No,
have to take it multiple times.
no, that's a very good thing to kind of be wondering about, right? Because it is something people talk a lot about. So, and it really depends upon where you go to school, maybe, where you're at. And that's something we strive to make sure that our students are prepared for. And it's something that you have to really work at. The NCLEX exam is something that is evolving. I will say that. In the past, our exam scores have been anywhere from that 97%. During COVID times, they have dropped. They have dropped to somewhere around that 93, 94% pass rate, which is not uncommon across. We have had some of the highest pass rates in the country. And we have trended like they have across the country to where those pass rates are. One thing to know about UAB is we are also the largest class in the state of Alabama. So we accept students twice a year in the spring and the fall for our traditional BSN program. And so with that traditional BSN program, the reason why we're able to accept so many students is because of our ability to place students in the hospital clinical sites. Otherwise, we would never accept that many students into our classes, right? So in any program that you look at, so when you go to apply to nursing school, when you're thinking about applying to UAB and any other program, their ability to admit you into their program is based upon their ability to put you into a clinical site, okay? So having said that, the NCLEX exam, we're giving you smaller tests along the way. And there's a system called ATI that we use. And those are small tests that mimic the NCLEX in different subjects along the way to help you prepare for the NCLEX. It's hard. I've not personally taken it, so I can't lie and say that I know what you're going to do. I can't say that for sure. But it is tough from what I can tell you. And it's also changing. There's a different model of the exam that's coming out. So rather than giving you 7 multiple choice questions and every question being correct and you choosing the most correct question, in the future, what that test is going to look like is you're going to have a case-based question. And what will happen from there is you will have to essentially assess your patient and answer the questions based upon the assessment of your patient. So that will be the format of the new NCLEX exam. So our students are a little more excited about the new format of that test because they feel like it fits how their learning process has worked in the past. So we shall see based upon how that, truly formulates with how they do on the exam, I guess. So let's see, scared of failing classes.
I can take some of that over, Annalie. So that's kind of things that I would help students with as academic advisor on picking courses, making adjustments as needed for potentially failing.
I saw Leah had mentioned that there is absolutely no prior CNA or really there's no required shadowing or volunteer experience required, right? It is recommended because what we're looking for is that you kind of know and have a good idea of what you want to do. If you're going to come into nursing, we want you to know that this is really what you want to do. Can you handle the sights and the smells and the sounds of what nurses are going to do every day? But if you have other leadership experience, teamwork experience, we have students who have worked in a restaurant or they've been in Greek organizations and they've been leaders in those roles. There's other ways that you can demonstrate that experience and that you're going to be a great teammate and leader in a role as a nurse. But we just need to find ways to communicate that, right? And there's ways you can communicate that through your writing. But remember, writing skills are also important there. So there's definitely ways to do that. So, but just recommended, not necessarily required. Leah, I'll hand it back over to you.
Yeah, Ellie, if you could put the link to the BSN program website and probably joint as well in the chat, that's going to frame some of what I'll probably cover right now. Admission to the BSN program, a lot of it has to do with grades. So it's good that you're thinking about that. It's a good thing. We look at two different GPAs. Well, the admissions committee does. One is your overall GPA. I'll show you what that is. The second is called a nursing foundations GPA, and I'll show you what that is too. So starting with overall GPA, your overall GPA is built out of everything you've ever taken in your collegiate career. So that'll be things like English composition, literature, fine arts, but also sciences too. Things that you might be pursuing on the side, like maybe a minor, maybe if you're taking some upper level courses in something kind of maybe like psychology, or you really want to be a great Spanish speaker or something like that. Anything you've taken goes into that overall GPA. The second GPA is called your Nursing Foundations GPA. And what we've done there is the faculty have pinpointed or zeroed in on certain classes that they think indicate a successful nursing student. If you can do well in these classes, usually they feel pretty comfortable in your ability to do well in the program. So those classes are English Composition 1 and 2. No, they're kind of first year courses, but they're super important. Best grades you can get in these, the better you're going to be off. Math and chemistry. You're probably in those or working towards getting into those this semester if you're a first semester student. And then your biology classes are included in there. That makes good sense, right? So anatomy, physiology, microbiology. Nutrition will be coming along eventually too. Developmental psychology, which is what you take after intro to psychology, and statistics. So all those classes together create a second GPA that they're going to look at. Now, if you clicked on the website link, you'll see that 2.75 GPA is what we're saying. You should have that minimum GPA of a 2.75 for both of these to apply to the BSN program. That being said, we have a lot of interest in these programs. And so GPAs are quite high for people who are applying. Generally speaking, I feel good if my students have at least a 3.2, but 3.5 is probably better. So that's where you want to work with your academic advisor very, very closely. They can give you ideas of where you're standing right now. You can use GPS and see those things. So some of you may not even have a GPA at the moment at all. But what you're doing this semester is going to create that solid foundation in order to be in that BSN program. So every class counts is what we're saying. So that English composition class that you're in right now, 101 is acceptable. I know I got that listed there, but 106 is also acceptable. There's substitutions there, so you don't have to go back and get 101. But that's that first A that you can get. And A's help you out down the road when you get in more challenging coursework, like that anatomy, like that chemistry. So do yourself a favor in those lower level courses, really give it your all, and that gives you a bit of a cushion later on.
I was just going to say, there was one really good question I think that would be helpful here about how the classes, if you are trying to get from undeclared status to that pre-nursing, and just kind of what that looks like.
So back in the day, I was an undeclared nursing advisor, and I'm working with people just where you are right now to get into our nursing program. Your goal, even though I'm going to say minimum, is a 3.0 and 18 credit hours here at UAB in order to change your major to pre-nursing. And that would move you to a new advisor over here in the School of Nursing, maybe me, maybe somebody else. But again, that minimum, your minimum, don't think that's where I should aim. Aim higher. But again, that'll probably take you towards the end of the year if you just started here this fall. Probably not in 18 credit hours this semester, probably in somewhere around 13, 15 credit hours right now. So it will probably take you until the end of the spring semester to do that. It does not look bad at all to have previously been a UDNU student. We don't make negative marks on that. We're just watching you get through those courses. So prove to us with that coursework that you belong over here. We'll bring you right over and treat you just the same as our other students who showed up on our side of the campus. So change that major is always saying. Maybe that answers that question.
Yeah, everyone has a journey. So just remember that, your journey is unique. And so it's more about how you get to where you're going. So what other questions do you guys have for us? We
Okay,
want
what if you are in the Dean Scholar program? How does that work?
Yeah, Morgan, for our Dean Scholar pathway, what that is specifically a program for high school students coming out of high school. So you have to apply to UAB by December 1st of your high school senior year of high school. Sorry, let me be clear on that. So December 1st. And then when you are coming in out of your high school year, then you'll have to maintain a 3.2 therefore. So essentially when you're working on your prereqs, it's a 3.2 or higher GPA in your freshman and sophomore year. And as long as you maintain that 3.2 and had declared pre-nursing as your interest, then we are able to maintain our end of our commitment, which is that you would be a Dean Scholar, which pretty essentially allows us to hold a seat for our students up to a certain number, which at this time is around 200, 250. And so we try not to say there's an exact number because we don't know where that cap is at this time, but we haven't gotten there. So once we get to that cap, we may have to give an exact number on that cap, but that's roughly where we're at this time. So, but anyway, but from there, the Dean Scholar students, when they get ready to apply, they still have to complete an application and all of the same things that every other student has to complete. And when they submit that, there will be an opportunity in either the spring or the fall semester for them to come into the program. Now, just because a student does not have a 3.8 or anything like that when they come out of high school does not mean they cannot get into the nursing program. So.
I saw a good question about the application process. So I can speak on that, I think. Right now we're in registration advising, just like a lot of y'all are. You've probably been meeting with your advisors right now to pick out spring classes. So we've got students doing the same. So I've got new freshmen, but also have sophomores who are picking out the remainder of their pre-nursing curriculum. Most of the time, students are usually done with those within that first 2 years of undergraduate study. Usually get through some science and stuff first year, wrap it all up. And so as they're registering for spring, maybe making some summer plans, they're really getting done. So I'm talking with them right now about the application process to the School of Nursing for the fall semester, because basically they just have to be done with it, everything they need, all those classes, before the program begins. So we are talking about that, and the application opens quite a bit earlier than the program actually starts. So those students are going to be applying to the program in March. So I've been telling them March the 1st is the date you need to circle on your calendar and put sticky notes up everywhere, because it's kind of on them to remember to look for an email from me. So usually I email the students and I say, hey, are you looking to start the BSN program for fall admission? If so, do these things right here. So when those students do that, we talk about it in our office, but they get a lot of links and things to read afterwards. But basic requirements for applying: those GPAs and finished coursework, filling out the application itself, which is really just, who are you? Where are you from? Where you live? How do we contact you? Kind of demographic stuff. At the tail end of it, they're going to be instructed to upload some documents for us. So those documents, one is an essay. And in that essay, they're going to basically answer the question of, what is your concept of what a nurse is? What's the role of a nurse? What do they do? And then the second part of that question is going to ask, what kind of skills, qualities, traits, experiences do you have that would make you a good candidate for the BSN program? And because of the volume of people that we see applying to our programs, that's all we're asking for you is just that. We don't do interviews. We don't take references, letters, stuff like that. It's this essay, as well as a resume that you'll create. Both of them are 1 page. The resume is restricted to things you've done since high school. So if you had a really cool, awesome thing that you did in high school, like I forget, there's a program that a lot of y'all are in, had done, that won't count, unfortunately. You can talk about it in your essay. It's very formative. Anything goes on the essay, but that resume is strictly since high school moving forward. So if you are not involved on campus, it might be a good opportunity to do that. If you have a working job, I think that was already covered already. There are transferable skills in those campus jobs, off-campus jobs. I think we've said that exposure to nurses, shadowing or volunteering, or even something like a patient care tech job, is nice. It's not required. I recommend some amount of that, maybe not fully diving into 39 hours of PCT work. That's not usually my recommendation for you guys. Your grades are much more important. I've been telling our first year experience students, no amount of volunteer shadowing will make up for poor grades. You'll just be very tired and not in a nursing program. Okay. But anyway, I like them, a little bit amount of it on those breaks, like fall break, Christmas break coming up, good times to get opportunities like that done. But I like it because it lets you be sure that you want to be a nurse. And so I think I heard Annalise say something, the sights, the sounds, the smells, they impact you, and you may not be expecting those things. We have some physical responses to those things. And for me, there's a vibe check. I don't know if y'all do vibe checks, but there's a vibe, and I get the heebie-jeebies in a hospital. I need you to see if you get the same. Additionally, there are more people working in a hospital than nurses, yeah? So you may see that physician and be like, that's what I want to do. Or that PT may come in and do some services for that patient. You be like, not very neat. I think I might want to do that. So I want you to see the variety of people you encounter in healthcare. Even a social worker. There are social workers on the medical team, and that may speak to you more so. You might like that relationship building, that connecting, communicating with people from your hospital, other care facilities you're trying to get that patient to. That may be a skill of yours too. So I like it for that reason. And it helps you write a better essay, truth be told, as well. We all have kind of ideas of what nurses do. You might have encountered a nurse, you were sick, family member was sick. You saw that interaction. You saw that point of their job, but not what they were doing over there when they left the room. Yeah. So I like that. Y'all should at least talk to these people and say, what's your priorities when you walk on the floor first thing? A good question I want y'all to ask nurses is, if you were going to hire a brand new nurse, what kind of qualities, traits would you want that person to have? And then reflect on how you have those things. And then put that in that essay. So exposure to nurses is so good. To number one, solidify this is what you want to do. Number two, add something to that resume and give you something really good to write on that essay. Make sense?
And if I could just add to that really fast too, I would say one recommendation I always give on this process is where you're at right now, keep a journal, right? Keep a journal of every interaction that you have, whether it's a healthcare professional, a nurse, and that way, whether it's positive or negative, right? Especially if it's negative, that way you know what it was about that. Like she said, they gave you the heebie-jeebies, or that turns you off about the care that they provided for a patient, so that you can reflect on that in an essay and how you would really strive to do something differently one day in the care you provided, right? You can connect all of those pieces and something long-term when you do see care that takes it the extra mile for a patient. So those things, you might start now coming out as a freshman, and you may end up with 20, 30, even 200 pages of little notes that you've taken, depending on the experiences you've had. And it may be way too much to put together in a 1-2 page essay, but you'll be able to take the really high notes that Leah was going to be looking for, right? When they're looking for this essay that we need for the nursing essay. So just a thought. Also, Leah, there's a question in here that I think that is perfect about change of majors.
I saw that.
Yeah.
Yeah, it's certainly easier to come from a STEM major into nursing than from nursing into a STEM major. So the things like biology, chemistry, you'll have like Gen Chem that you take, a little bit higher math and stuff like that, but we will accept those and substitute most of the time. For like Gen Chem, we will accept for intro to chem that we need for nursing, we'll accept that. Biology 123, we would accept for Chem 107, 108. It works in the prerequisites. Higher maths are fine. We could certainly take a higher math. So that was the better way to do it than the other way. There's some where we would, let you decide between the two. But we have a lot of students who think, well, nurses and doctors are similar, so the prerequisite, getting there would be quite the same, but it's actually two very different tracks. For a little bit, they overlap, but not long at all. So if you think of nursing, I would have an appointment with us, get some course recommendations. If we're full for appointments, maybe email me. I could give you some course recommendations while you wait on an appointment.
I also saw the question about shadowing. So the School of Nursing can't set up shadowing for students outside of our program specifically that are in our class. However, if you're interested, reach out. The hospitals have volunteer coordinators, and on their website, you can actually submit an application to volunteer and get some hours in. And also, there's a little note in my response there. Don't forget about the hospice and home health care agencies. They oftentimes have a great need for volunteers, and we automatically, our brain thinks to go to the hospitals, right? Because they're such large organizations. But especially during COVID, they were looking for volunteers and desperately asking us for students. And that was just a place that a lot of people don't automatically think to go to. So, but think of all the organizations that have those healthcare providers that you could get that outreach. Nurse practitioner, yeah, that's a great question. So if we think about that first slide that I had up, right, where the nursing courses themselves were 5 semesters, then once you finish your bachelor's degree, it's really dependent upon when you're ready to come back to school. We have a couple of different options at UAB. So you can do a master's prepared nurse practitioner program in 2 years, or you could do a doctorate level and just skip the master's. So we have a doctorate level nurse practitioner pathway that's available for students that you can complete in 3 years in a semester, so about 3.5 years. And a lot of our students are kind of choosing and shifting toward that doctorate prepared nurse practitioner pathway, just because it is a terminal degree and because of the great need for medical providers, especially in our rural communities. We're seeing that shift. So I do think that that will be the long-term plan, is for more and more students to go on straight toward their doctorate as a nurse practitioner. But you can plan for, unless you're looking for your CRNA, certified registered nurse anesthetist, or you want to be a neonatal nurse practitioner, you would absolutely have to have 1 year of nurse experience before you can come back to school. Okay. Everyone else, it's recommended you have at least 1 year of work experience before you come back to school. All right. So if you keep that in mind, 1 year or less before you come back to school, then about 3.5 years from there, if you're planning things out. So as far as travel nursing goes, so this is a question we get a lot right now. We do not prepare you necessarily to be a specific travel nurse, quote unquote, but we prepare you to be a nurse in general, right? So you can be any kind of nurse coming out of UAB. If you think about it, you'll be a generalist and you can go to work anywhere. So you're going to be working with patients from that life to death spectrum. Okay. So you're going to learn a little bit about everything, and it's up to you to choose who you're most passionate in that population to go and work with long term. So when you graduate from UAB, you're probably going to have about 3 different areas that you're most passionate in working within, right? And they could be vastly different. If you're interested in traveling, you are probably going to want at least 6 months to 1 year of hospital experience before you travel, right? And I say that because when you travel as a travel nurse, you are put in the most difficult, the most serious and complicated scenarios. Because when you travel, you are also put in the places where they can't fill positions, right? So you're not given the same orientation period because you are traveling, right? And you don't have the hospital there to staff you and orient you. So it's really important to be confident in your skills before you ever take a travel job. So keep that in mind, and you'll hear about it more as you're going through school, because a lot of people are thinking about it because the money is so good. Right. But it's definitely a really serious thing to take into consideration. So, all right. So I'm confused about schooling. If I want to be a nurse anesthetist, what is the process? Great question. So nurse anesthesia, what that process looks like is that it's a slightly different process than a nurse practitioner degree, in that for nurse practitioners, you can work and go to school at the same time. All right. So In this case, a lot of hospitals will actually help pay for you to go to school while you're completing that graduate degree. In this case, because you can't work and go to school for the nurse anesthesia degree, they can't help pay for that, right? Because they need you to be working at the same time. So when you finish your bachelor's degree at UAB, you are going to need to get at least around a year, it's 11 months specifically, but around a year of critical care experience. Once you have that experience, then from there, you can start to apply to come into the nurse anesthesia program. All right. And there's some things you can do to actually try to increase your chances for getting admitted the first time. And Leah just, I think, included the nurse anesthesia link. We do an information session about that program, myself and the faculty member for that program. We talk about certifications and things like that for the critical care experience. So you're welcome to join in, even if you don't know what questions to ask. There are a lot of people in that session. So, and we do this for every specialty area, okay? So keep that in mind. But once you are in that program, it is also 3 years and 1 semester because it is a doctorate program. So it is that same doctorate of nurse practice that the nurse practitioner program is that I mentioned earlier. So 3 years and 1 semester. When you graduate, you are a doctorate, but instead of a doctorate nurse practitioner, you are a doctorate nurse practice nurse anesthesia. So I hope that answers your question, Denise. So for neonatal nurses, it would be very similar to that nurse anesthesia process we just discussed. So they very, how do I say this? The neonatal population is so vastly different from an adult population and even pediatrics. And because they are so highly specialized, there's only so much that we can practice within or what we call our mannequins, our patients in the labs. Once you get over to the neonatal units, there's going to be a lot more that you're going to be able to experience, even beyond the time you're going to get in our rotations and clinicals. And so it takes about a minimum of a year for you to be able to see enough different cases. And there's so many conditions that those babies will come in with for you to be able to see, to rotate through, for you to get that confidence level and knowledge base, for you to have, we don't reteach you when you come into the nurse practitioner program. We don't reteach you when you come into the nurse anesthesia program. So you've got to have a base level of knowledge for you to come into those programs. And that's why we require a minimum amount of experience for those two things. Everything else, there's a base amount of experience that we teach in certain programs because it's expected. Others, there's too much information for us to be able to teach, to have a jumping off point. So that's why the requirement in the process is different for the neonatal and nurse anesthesia. So, but you do have the option for neonatal to do a master's or a doctorate degree. So you do have the option for either one.
So as far as just students that are, undergraduates completing their BSN or hoping, to complete their BSN right now, what kind of characteristics would you say are the most important for them to be successful in the bachelor's program?
So we are looking for well-rounded human beings, right? So just a solid, they've got to keep focused right now on their GPA. That's the piece of it, those core science and the GPA. And don't ever forget about writing skills. A lot of students kind of, get a little more focused on the sciences and forget about their writing and how important that component is. Leah hit on something very important earlier with the essay and how they will give you those lead questions. And sometimes students will do a great job in answering like one of the questions, but then kind of like get a little off topic and just, start getting into something they want to say, but they don't really answer another part of the question. And so the one thing I feel like they're always looking for in nursing is they're looking to see if you can follow instructions. right? No one
Mm,
wants a nurse or a doctor who cannot follow instructions. You don't want someone to administer your medication, right, who doesn't follow instructions. So keep that in mind, whether they ask for your student ID and not your name, right, at the top of that form, or they ask you 3 questions within that page and a half. Just be sure you hit on all 3 questions. However you do so, make sure you do it. I think that's one of the most important things that, even though it's not a physical characteristic, it's one of the things that one of the first ways they get to know you is by reading that essay. So, Leah, what do you have to add to that?
I would say just strong science skills. Um, I would say if you're struggling in those early sciences, it's may not be a good fit for you major wise. I mean, just might not be a strength. Um, we have students retake classes and, retake classes, but you're just increasing your cost of attendance. And there are probably better ways if nursing has to be what you're going to do. There's probably other avenues that wouldn't cost as much and might not cause you quite so much heartache. So talk with us if you're having struggles here at UAB. There may be another route that might be better suited for you. Um, so monitor yourself. Are you in those science classes and are they your least favorite classes? That might indicate that probably not a great major fit, and you would want to talk with your academic advisor at that point. This is a science major, it just truthfully is. And the base of what you need to know in the BSN program is that chemistry. It is that anatomy, phys, and micro. And you're trying on this track to get in we're number 9 in the country of BSN programs. It's hard. So we're preparing you to go into that hard thing so it doesn't plateau. I got past anatomy, it's all downhill from here. No, it's not. Anatomy is preparing you for what's still to come. So monitor yourself, ask yourself those questions, and be honest with yourself about what the answers to those things are. And then communicate with us. Like we said, there are avenues to get where you want to go. A lot of times it may just be not nursing at UAB, but nursing somewhere else or a different route to come back to UAB and get maybe our RN to BSN degree or something like that. That being said, think about what your strengths and interests are. UAB is a great place to be if you just want to help people in some kind of way in healthcare somehow. Things like public health and research and stuff like that, and discovering what's going on in our communities, getting resources to people at the ground level so they don't go into the hospital in the first place. There's so many things that you can do at UAB that will help you impact people's lives. So broaden, your idea, come to things like this major fair, listen, attentively. If you're going to another one today and you're not super interested in it, don't check out, don't get on your phone, don't have a nap. Give it a shot. Give it a shot and keep it on the back burner because we have healthcare management. I always point over here to the hospital. I was like, the doctors and the nurses, while awesome, are not keeping the doors open. They're not keeping the power on. They're not working with social services and all this kind of stuff. There's other people making that all run over there. We're the largest employer in the state. We're not all doctors and nurses. There's a lot of people making things run over there. So healthcare management could be a neat route for you. Marketing, y'all see billboards to UAB medicine? People put it out there. So think about things that interest you outside of this narrow focus for career. What are you good at? What do you enjoy? And then think broadly about what it is you could do and go inquire with people. Y'all can meet with any academic advisor on campus. You look them up in My Appointment. If y'all are really clicking, you're just like, I really like my psychology class and I think I could be a counselor or something like that. Meet with psychology. Do it. It doesn't lock you into anything to get more information. That's it. Be critical of yourself and explore all options.
Darian, what happens during clinical? So clinical is a time for you to take what we talk about in review during lecture and during our lab discussion and practice and put that into a hands-on mode, right? So a hands-on, I call it a patient form, right? So in our labs, we have mannequins, which we call our patients in the School of Nursing, but this is something more in actual patient form. And so our lecture size is 150 students. But when we get into lab, into clinical, we would never put that many students into one grouping at the same time. So you might have anywhere from 12, 18, 8, 6 group size to 2, right? So it varies dramatically depending upon what we're doing in that clinical group. And so you can expect a much more individualized experience in those clinical groups, depending upon what the rotation is and what you're learning. But during that, it will also be when I mentioned that birth to death, life cycle that you are learning, you are going to have to, if you don't like to see the sight of blood or deal with blood, you will have to do those things, unfortunately. And that is part of nursing. You will have to get through that. That doesn't mean you'll have to always work with it the rest of your life, but for these 5 semesters, that will be part of it. You will also have to clean patients. You'll have to learn how to move a patient to and from a bed, to and from a wheelchair. You'll be feeding a patient. We will do all of those things because we want you to have the full context of what it is to care for a patient. And then we will go through all of the steps from psychiatric care to critical care, trauma burn. We mentioned neonatal, oncology, mother baby, general pediatrics, and I'm missing a lot. Telehealth, the form of what we're doing here, but if our physician is in Texas and our patient is here in Birmingham, caring for that patient virtually. So there's so many forms of medicine that we're very fortunate to have here at UAB. And I do encourage students, like I mentioned earlier, when I was throwing that information out at the beginning, including the joint enrollment pathway. I know the ACT thing, people are like, I don't want to hear it. But when we do think about giving yourself a competitive advantage, that can be a competitive advantage to be able to kind of put those eggs in all the baskets, right? So at the end of the day, if your GPA is kind of like sitting right there in the middle, but you might not be right where you want to be to get in at UAB, but you could possibly get yourself a chance to get in either in the traditional ADM program and maybe joint, but there's some pros or cons to which one might be better. You could choose. And for some students, we can talk through what the best choice
is that our faculty know what you are doing when you're trying to run away from UAB and take those classes elsewhere. All those core area 5 classes, anatomy, micro, stats, nutrition, and even a little bit the chemistry too. If you go to a junior college for those, you had best get an A. I heard that out of a faculty member's mouth in the hallway. So they are looking for the best of the best, and they have so many people that they can be that picky. And it's just going to save you so much heartache if you can just stay on track with your advisor on taking classes here. Anatomy, the further your delay in your graduation, period. So I know some of y'all might be scared about it. Anatomy's hard. Nursing school is hard. You got to be hard,
I think that's great advice. A lot of students that I talk to are always like, oh, well, my mom or aunt or sister or brother XYZ is a nurse and I just like want to be part of it. And like they make it sound really great. So they want to go through the whole program and the degree. And I'm like, maybe you should, think about it a little more.
Contact information is out there. So mine is out there. Our faculty members are out there too. If you feel like you need to ask them something, just email them, address them properly, Mrs. Hogwood, Dr. Mitchell, you can see the prerequisite courses out there for the programs. So they're there. The requirements for GPA and stuff like that is out there. Deadlines are usually out there. Again, we admit for fall and spring semesters. We don't have a summer group. Basically, about 150 students admitted in each of those 2 admission cycles. The students ask me like how many people apply. It varies cycle to cycle. Usually fall semester has more students because we try to get you guys through the curriculum, and most people get through in that they start in fall, they go fall, spring, start in the fall. So most people are applying then, but other folks brought in transfer credits. We have transfer students and all kinds of things. So we have a fair number of people still apply for spring. So not a small amount, more than we have room for. But we have that limit of numbers because we can only train so many people in the hospital at a time. We have so many clinical spots is what you'll hear.
Mhm.
There are things out there for cost. So we've got some fees and things like that listed. Students have to buy a good bit of stuff before they get started. So they have to buy like a lab kit. They have to buy scrubs and stethoscope, stuff like that. So there's some added costs that pop up. Tuition changes a bit in the BSN program too, so you may want to look at that. We have an honors program in there. This nursing honors program is different from honors college. That may be something that might interest you too.
Mhm.
Again, our contact information is out there. If you think of something later,
Mhm.
you can find us that way. I'll put my email. My email is just my last name, y'all, at uab.edu. We are down an advisor at the moment, but we're working diligently to get another. So I apologize if it's a little slow for me to get to y'all. We are taking care of about 600 students at the moment. So, but I will try to get to you as quick as I can if you've got a quick question.
Well, thank you so much for coming by and answering the questions and giving kind of an overview of the program. And I feel like I learned